On this Friday night, a big boost for Canada's small and medium-sized businesses. The wage subsidies the Prime Minister is promising, plus Canada's key interest rate drops about as low as it can go. Ontario's emergency alert to travelers, as BC reveals its worst-case scenario. Plus, 200 Canadians stuck on a virus-infected cruise ship, and at least 4 passengers have died. Ventilators are like gold. Why are politicians in the U.S. fighting over them?
I don't believe you need 40,000 or 30,000.
Plus, Britain's Prime Minister and Health Minister test positive, and clocking in from the kitchen and coping with the cat. Perks and perils of working from home.
Global National with Donna Friesen.
Good evening and thanks for joining us. Lots of developments this Friday, starting with a lifeline for companies whose business has been killed by this virus. The federal government will subsidize the wages of employees in small and medium-sized businesses, part of a sweeping new aid package. It will cover 75% of workers' wages, an increase from 10% announced last week, and it will be backdated to March 15th, so employers can hire back people they've already laid off. As well, the government is offering loan guarantees for small and medium-sized businesses of $40,000, and it will be interest-free for 1 year.
Our hope is that employers who are being pushed towards laying off people because of COVID-19 will think again. And for those of you who've already had to lay off workers, we hope you will consider rehiring them, given this payroll support.
The Bank of Canada is also moving quickly. It slashed its benchmark interest rate again, reducing it to 0.25%. That's the lowest the bank believes it can go. Governor Stephen Poloz also announced plans to buy up debt to try to keep money circulating in the economy. He says he's doing all he can to keep the pandemic from tanking the economy.
No firefighter ever got criticized for using too much water.
All of this is designed to keep businesses afloat through the worst of this so that they can get up and running again when it's over. David Aiken reports.
A barber shop, its chairs now empty for 2 weeks.
We have to take this decision, safety for my team and for my clientele.
But a decision that comes with costs. With no revenue, thousands of business owners have had to lay off employees. But now, new help, which Ottawa hopes will let business owners bring back some workers. A massive wage subsidy. Employers will see the federal government cover 75% of the payroll, backdated to March 15th.
I think it's good. It's a good percentage. And it's a very, I feel it's very good for the Canadian citizen.
In addition, a new government-backed loan worth $40,000. Businesses can also defer submitting their GST, HST, and other federal taxes until June. That's a move that amounts to an interest-free loan. Now, many details will not be announced until next week. How big a business, for example, will be eligible for the wage subsidy, and will there be a cap? But one of the federal government's goals with these measures is to slow the number of new employment insurance claims made at Service Canada centres which the federal government closed to the public Friday out of safety concerns.
The health and safety of the Canadian public and also to our members that are serving the public. And that's been our main focus all along.
The government wants to move all applications for EI online or to the phone, a move many found frustrating.
Their offices are all shut. You can't talk to anyone. Try calling the phone lines. Call first thing in the morning. The line's busy. You can't get through. The call demand is ridiculous.
Now, these new measures for small and medium-sized business obviously are for immediate relief, but they're also important to help keep employers and their workforce together. And that is going to be critical to make sure the economic recovery is as strong as it can be and as quick as it can be once this health crisis passes. Donna?
Okay, David Akin in Ottawa, thank you. Let's look at the numbers now. Everyone's watching the numbers across the country. More than 700 new cases were confirmed across Canada today. BC had 67 new cases. Quebec once again had the biggest daily spike, 392 new cases there. 10 more people died in Quebec. That brings the death toll there to 18. In Canada, more than 4,700 people have now tested positive. 55 people have died. Every province and territory except Nunavut has detected the virus. And as you can see, the numbers are going up right across the country. Quebec, Ontario, Alberta, and British Columbia are hardest hit. Ontario Health Minister Christine Elliott said that province is using every tool possible to inform the public about the critical steps they must follow to limit the spread of this virus. Ontario has been sending out emergency alerts to cell phones, radios, and televisions. That's the alert. It demands travelers who have recently returned to Canada must and are required by law to stay home and self-isolate for 14 days. That means no shopping or visiting family or friends. Many of the recent cases in Canada are among people who have returned from traveling. The head of the World Health Organization says the chronic global shortage of personal protective equipment, or PPE, is now one of the most urgent threats to our collective ability to save lives. Without that gear, healthcare workers get sick. In some cases, they're dying. PPE and ventilators are now a far more precious commodity than oil. We're hearing already about rationing and shortages in Canada. And as Abigail Beeman reports, some doctors are even soliciting donations.
We have over 10,000 hits across those websites. It's essentially a resource for the public to know what they can donate.
Dr. Sunny Johal is an emergency physician so concerned about personal protective equipment on the front lines, he started Mask a Hero, connecting donations with hospitals in BC and Ontario that need them. Some hospitals are already rationing masks. Thursday, Prime Minister Justin Trudeau promised more equipment.
Millions more items that are necessary.
But when will they actually get to hospitals in need?
And I can't give you an exact time or date for all of the various pieces and types of equipment, but rest assured that we're looking across the globe and also obviously in Canada.
The federal government is working with the provinces and territories and their different needs as officials everywhere stress the need to stay home and keep physical distance. BC now has early evidence that it's working.
The planning that's being done should allow us to adequately care for everybody who needs it. So much of that depends on us all doing our part to keep this from going explosively.
There is also worry about enough equipment for patients as well as healthcare workers.
We have limited number of ventilators. We know a certain proportion of these patients will require critical care and ventilation support. So I worry about that being exceeded and deaths being higher than they need to.
That scenario being planned for too.
We intend to have ventilators available to whomever needs them. But yes, we have an ethicist that is at the command table. We are building out an ethical framework.
Choices about who gets help, no one wants to have to make. Abigail Beeman, Global News, Ottawa.
It's obvious we can't wait to see what's coming to react. We know what could be coming. We've had 12 weeks to get ready, buy equipment, and restrict people's movements. Governments are preparing worst-case scenarios, and today, British Columbia made public its projections. If what happened in China or Italy happened in BC, would the healthcare system be able to cope? Eric Sorensen reports.
The Lynn Valley Care Centre in North Vancouver saw Canada's first death from COVID-19 and showed how the virus could spread. BC health officials are modelling expectations to manage this unpredictable virus. They're comparing BC with outbreaks elsewhere. That's BC's new cases where the star is. It's nothing like what is happening in northern Italy, the blue bars. But officials have to be ready for the worst. They would hope to maximize the number of beds to some 20,000. Then they could handle a South Korea-type epidemic with beds to spare. Only in a worst-case scenario, like northern Italy's hospital-based epidemic, could there be a shortage of beds.
The most serious model, the northern Italy-type epidemic, the hospital-based one, which we do not foresee, but which we have to prepare for. You see a shortage of beds here and only here.
In every jurisdiction, this is the big risk, a surge in COVID-19 cases beyond the capacity of the healthcare system, beyond the capacity of your local hospital. You can get more beds and more ventilators and increase that capacity, but what needs to happen is for people to stay at home to reduce the spread. That will bring the peak of the curve down so hospitals can manage the crisis. It would be for a longer period, but could avoid a worst-case scenario.
Saskatchewan has also modeled what could happen if a quarter of its population got the virus. A leaked Saskatchewan Health Authority document stated, worst case, demand for acute services will exceed existing capacity for hospital beds, ICU beds, and ventilators. And the very worst case, a death toll of 15,000 in that province. But it's just a planning tool.
What actually will result in Saskatoon for the plan is not what's on that page. It was to give an example.
Health officials must prepare for all possibilities, and the public must be trusted to do what's right.
If we can, get these peaks flattened quickly by everybody just staying calm and being rational about our choices and what we choose to do, then it shows that we can be trusted to make good, sound decisions.
Some forecasts may seem alarmist, but public trust comes from knowing the honest scenarios, the best and the worst. Eric Sorensen, Global News, Toronto.
Another cruise ship is infected with the coronavirus, and more than 240 Canadians are on board. And 4 passengers on that Holland America ship have died. The Zandam is waiting to navigate through the Panama Canal. More than 1,800 people are on board. About 150 of them, we're told, are sick. They will remain on board. The healthy passengers, we're told, will be transferred to another ship. The captain announced the deaths today. Holland America says the 4 people who died were older guests. The death toll in Spain soared overnight. 769 people died in one day from COVID-19. Another 7,800 people became infected. Health officials there, though, do say the number is beginning to stabilize. Almost 5,000 people have died in Spain, and hospitals are full, they're short of supplies, and are at the breaking point. Today, Spain's health ministry confirmed that more than 9,000 healthcare workers are infected with COVID-19. That's nearly 15% of all the confirmed cases in that country. And in the UK, the death toll jumped by 181 in 24 hours. And the thousands of infected now include the 2 top political leaders heading up the COVID-19 response, Prime Minister Boris Johnson and his health minister. They're now self-isolating, but what happens if they become seriously ill, and who else did they infect? Here's Crystal Goomansingh.
I've developed mild symptoms of the coronavirus, that's to say a temperature and a persistent cough.
Prime Minister Boris Johnson's positive diagnosis was just the start. In his video, he was calm and pledged to keep going with the important work to protect public health. But then his health secretary posted his own video.
I was tested, and that test has been positive, so I'll be self-isolating here until next Thursday.
Professor Chris Whitty is the face of the UK's public awareness campaign.
To help save lives, stay at home. Anyone can spread coronavirus.
He also has symptoms. The question now, did these individuals infect anyone else? People are supposed to be in a lockdown, only going out when it's absolutely necessary, and we've all been instructed to keep our distance from one another.
The rate of infection has been doubling every 3 to 4 days.
Officials say it's not a matter of advice being ignored, but proof the pandemic does not discriminate. There is some good news. Healthcare workers will be given a blood test to see if the virus is in their system.
This will be antigen testing, testing whether people currently have the disease, so that our health and social care workers can have security in the knowledge that they are safe to return to work if their test is negative.
Frontline staff say for them, those tests are as important as masks and gloves. Crystal Goomansingh, Global News, London.
The U.S. president is venting about ventilators. Coming up, his mixed messages about the need for the life-saving equipment. The United States, now the epicenter of the outbreak in the world, has more than 100,000 confirmed cases of COVID-19. There are certain to be many more because there has been limited testing so far. More than 1,500 people in the U.S. have now died. The virus is accelerating across the country, but New York City is still the worst. Many hospitals there are already jammed with patients. Ventilators are being shared, while political leaders argue about what needs to happen next. Jackson Proskow reports.
Already filled beyond capacity, New York's hospitals are stretching doctors and nurses to their limits.
It's been like a war zone, a medical war zone,
working with limited resources.
Makeshift morgues and refrigerated trucks are being used to store bodies. The first 1,000-bed temporary hospital is still not finished, and the governor is already planning to build 8 more across the state.
Now we're looking at about 21 days for a possible apex. So we want to do everything we can to be ready for that.
More than 400 New York City police officers and 200 firefighters have tested positive for the virus. Calls to 911 have surged beyond anything the city has ever seen.
In a 24-hour time period, we did over 6,500 calls, which is a record for EMS.
The governor has issued a plea for Washington to step up and provide 30,000 ventilators to meet expected demand. But on Thursday night, the president cast doubt on the need.
A lot of the numbers that are being said in some areas are just bigger than they're going to be. I don't believe you need 40,000 or 30,000 ventilators.
On Friday, Trump reversed course. He's now requiring General Motors to make ventilators, using the Wartime Defense Production Act. Meanwhile, the situation grows more dire by the day, as case numbers surge in Michigan, Georgia, and Illinois. Hospitals now have to make tough choices about which patients they can treat. Doctors have even turned to the black market for basic supplies they can't get anywhere else.
We came together as an organization and we said we have to protect each other first if we're going to be able to serve the community.
American lawmakers passed a $2 trillion economic bailout. It was signed into law by President Trump. It provides direct payments to American citizens who've lost their jobs and bails out big corporations and airlines. It is the first, but likely not the last bailout that will be needed. Donna?
All right, Jackson Proskow in Washington, thank you. Still ahead, how Canadian businesses are shifting gears to give back during this pandemic. There has never been a greater need for a whole range of medical supplies all around the world like there is right now. Hand sanitizers, gloves, masks, face shields, and other protective equipment, not to mention ventilators. Many large Canadian companies are switching their production lines to help. And as Mike Armstrong reports, smaller companies are stepping up too.
This is a brand new production line being built from scratch to make a product this company doesn't sell.
We have no intention to make this as a business.
Yves Dandurand is the president of AdFast. It makes construction products like sealants and paints, usually. The goal is to be up and running producing hand sanitizer by next week. And they're not talking about small batches.
Well, we have a capacity of approximately 32,000 liters a day.
Dandurand says he'll sell his new product at only the cost of the ingredients. The company's paying for the labor. He's even willing to share the design of the production line in case other companies want to jump on board.
Online, available, picture, drawing, everything.
The critical shortage of medical supplies could cost lives. More ventilators are needed for patients, while protective gear is desperately needed for the healthcare workers treating those patients. Well, some companies are stepping up.
The idea is here is to do the right thing.
Eric Wazana is shifting production at his Quebec factory. Instead of making jeans, he's now buying fabric to manufacture hospital scrubs. While Canada Goose is shifting some production to making gowns and scrubs, and Labatt, after brewing beer for 170 years, is now also producing hand sanitizer. This plant north of Montreal has a new product. Bauer Hockey says it's now making face shields for healthcare workers, that in this crisis everyone's on the same team. Well, they have teammates. A group of 3D printers in southern Ontario says it's producing shields to help until big manufacturers can ramp up.
We're not charging at this point. If I ever did charge anything, it would just be material cost.
What we're saying is about time to give back now.
Dandurand is appealing to other companies to step forward, calling on anyone who can pitch in to fight a common enemy. Mike Armstrong, Global News, Montreal.
Homebound from 9 to 5. Next, the perks and quirks of working from home. We know you're tired and stressed and that practically everything in your life has changed in a matter of weeks. That includes millions of people who are now working from home. So we want to end tonight with a lighter look at the perils and unpredictability of working from home. Here's Mike Drolet.
It's official. The so-called conventional generation is driving us insane.
This dad's face screams isolation.
You're doing just that? Yeah.
And if it's not kids, it's our pets. Maybe it's the quarantine talking, but I think cats are up to something. They're always there pawing at something or sitting in a devious way. It's different with dogs and all their tail wagging. Isolation has taught us a lot about ourselves and the tighty-whitey underwear choice of our colleagues' spouses. We've also learned about technology, like turning off cameras, sometimes the hard way. And my producer, Catherine, learned the art of video bombing from her roommate.
My apologies.
It's a lesson he could have learned from this man, who rose to fame because of his kids.
A little bit short.
And who now has seemingly given up trying to keep them out of his office. Perhaps he knows there's no refuge.
Hey, I found you.
You sure did. Working from home will either drive us batty or get us to laugh at silly things. Like rapper Cardi B jumping through Jenga.
Hip hop, hip hop, hip hop, hooray.
Or Rita Wilson trying to rap.
Tippy tippy paws, sometimes creeping up, I eat 'em up, your styles are older than Lou Rawls.
Clearly kids at home aren't an issue for celebrities. Mike Drolet, Global News, Toronto.
Ho, hey, ho.
I think it's the cats that are loving this the most. That is Global National for this Friday. I'm Donna Friesen. Staying home helps stop the spread. Just a reminder, and we leave you tonight with some encouragement to take courage. That's Tragically Hip guitarist Paul Langlois and his family leading a sing-along of Courage from their porch. We hope you can keep your spirits up. Thanks for watching. Take care of yourselves. Bye-bye.
So fast asleep in a hotel that has a layout and piss on all of your back.